a talk. It's about 10 minutes. I timed it. It should be about that long. Ron, can you get the first slide up? That would be good. Excellent. So this is my title, and these are my disclosures, so that I meet all the criteria for Amy in the back. But thank you. Thank you for being here. Thank you for everything you've done. This is a team effort. This is a team event. It requires extraordinary, not just leadership, but participation. This is going to be part of the theme I want to talk a little bit about as we move forward. This is the dinner at the American Association of Hip and Knee Surgeons. These are Kaiser physicians. They're all having an exceptionally good time. What is unique about this photograph is that they're having an exceptionally good time. They're all partners, they all work together, see each other every day, and they choose to spend their time together when they can. And I was so lucky to participate in that. This is something that I can tell you at the university we don't necessarily have. This is one of the strengths of Kaiser Permanente. It isn't so much the label, the blue lights, it's what you all mean to each other. Specifically when you work together in an area like sports medicine, which requires so much collaboration to get to an outcome. What I do to joint replacement is a little bit easier, frankly. Do put it in and it's done. You guys have to get that patient after their hip arthroscopy, after their shoulder arthroscopy, to the point where they can actually play again, and that is not something that the surgeon can do by themselves. So I was asked to talk a little bit about the beginnings of the conference, and as I was going through this, in 2004, the first meeting was in W Hotel. We wanted to make sure it was such a great place to go that people would actually come, because there was a great deal of pushback that this could actually work. But there was a reason why we did it. It turns out that at that time in 2004, we had started to look at something, which was this. This is a paper we wrote a couple of years later, but before this paper actually got published, we were starting to notice this. And between 2000 and 2001, we saw a blip in the number of joints we were doing, and by the time we got to 2003, 2004, we had almost doubled the volume. And in those days, we did one total joint arthroplasty and 2 hip scopes. Some people in an OR day. Someone who was really daring might do 2 hip arthroplasties in a hip scope. You can't keep up with this demand if you're only doing that. And we realized that in order to get to the next level, we couldn't legislate it. At this point, I was in the Associate Chair of Chiefs with Tom Barber. And we realized that we need to give our surgeons, our teams, the tools necessary to get there. You don't get that at the academy. We have to create a conference, which we later described this way. A conference that emphasizes what actually improves our clinical practice. Emphasize things that will make both our outcomes and our group practice, decreasing variability in what we do, improving results, supporting each other, working collaboratively. In essence, doing what keeps us competitive while delivering great care, do that better, and not so much focus on the pure science or the latest and the greatest. The Academy does that for us. We needed something different. We needed the JOJ conference. We needed something that gave us the ability to work as a team, working from the same playbook, so we could achieve great outcomes. And as that occurred, and as we gave JOJ the first YOTA, the YOTA was the first JOJ award, but then it's like the same thing like the cup. You can't just keep giving it to JOJ. So what do you do with it? You create the JOJ award. And this is actually the PDF file that was sent to the engraver to create the plaque that sits on that award that most of you don't get a chance to see because it doesn't get passed around. And that is YOTA. And it's been criticized that when I took the staff away and put a femur in there, I might have done a better job. But I don't know what you guys are thinking. I'm telling you, it's a little strange. The JOJ is 11 years old this year, and so is my daughter, number 2, on the ground after striking that soccer ball. She's going to score. That team will go on to the quarterfinals and in a couple of weeks the semifinals for the state cup. And this is how she felt afterwards. And this is how I felt when I saw Ron that the other night for the faculty dinner. Total high five. Unbelievable work that he and Rob have done to carry on this tradition. And we talked a little bit how much the conference has changed. There's twice as many people. It's a better attendance. The conference itself, the structure has changed drastically. And it reminded me that my daughter, 2 years ago, required a very different type of education. And 4 years ago, she required a very different education. The same is true with the JOJ. In 2004, we were 100 or so surgeons. We had about 20 PAs. It took us 3 hours to do a joint replacement. We were considering to think about the value of creating a sports medicine process. And Harley Goldberg, that's his name, right? Yeah, he worked so hard to put this together, but it seemed like a really crazy idea. And by 2015, here we are. It's part of, we wouldn't even think that we don't understand the concept of an organization without a sports medicine team. What's it going to look like in 2030? The challenge is going to be very different again. And so this conference has to change. It has to continue to move along. It has to innovate. It has to create new visions. It has to create new solutions, new tools for you to use to create the outcomes that you all want to create and to continue to be the leaders, to continue to be ahead of the pack. But what hasn't changed, and I find this remarkable as I was putting this together, is the vision of JOJ. When we asked them, okay, this award sounds like a great idea, what should it be about? He said teaching, research, and leadership. Think about the values that represents for all of you. In 2004 versus 2015, I have a warrant, it'll be the same values in 2030. That will still identify those leaders in an organization like Rob who have really delivered when it comes to creating value for the organization. So what's teaching mean? I'd like to broaden a little bit beyond resident teaching because not everybody has access to resident teaching. And not everybody can aspire to be JOJ, and he's the ultimate. He's maybe the benchmark for all of us. And he loves resident teaching, so I try to follow in his footsteps. And actually, as a parenthesis, I don't know if you realize how amazing it's been. So I was his junior, I was his resident. We worked on the conference together. Then I went on to Kaiser. And then I went on to Oakland to be the chief of Oakland. And then I went to University of California. It sounds familiar. You heard a little story in the background. It's like when I'm at a house in Hawaii in the future. It looks really good. I'm looking forward to that. So I like resident teaching. There's a class I have, and it's a class about the difference between Nebbiolo and Brunello's for the residents. And it's very rewarding for those of you who have access to residents. 6 of these people on this slide are currently teaching other residents. It's a really great, great thing. And at least 3 of them are now working at Casa Permanente. If you haven't heard Todd speak from the stage, he's inspirational. He's an amazing speaker. He reaches people across the state. And some of us can do that, and that should be valued, and it has been valued. You were nominated. But not everybody is that good. Not everybody is that skilled. Some of us do better in this situation, one-on-one. Teaching the PAs or the staff what we actually do in the operating room so they can do a better job of helping our patients. And this also is teaching, and this also needs to be rewarded. And then some of us are actually better one-on-one. Bringing our patients from the moment of uncertainty and fear of what's coming with surgery and illness and bringing them to the other side. How about research? Now research, this kind of stuff is a little difficult. It's the kind of stuff I can do at the university. It's a little trickier for you at university, but this you guys can do in spades. Databases, big data. This is what the registry really is about. It's also linking the registry to the data sets of the pharmacy, the data sets in Southern California, in the East Coast. Very few organizations have access to this. But let me reframe a little bit what you could do, which we haven't done yet. There's a company called IASTI, it's out of Santa Clara, and they do what's called affinity mapping. And they do it this way. They collect the data first and ask the questions later. How very unscientific. Right? Not what we do. But you see this little green dot up there? That green set of people are patients who go out of the hospital faster than the ones below them in red. And when they look at the data and they do the sort of clinical analytics, they've identified the right, those red and those orange and purple boxes. Those elements are consistent for those patients that led to them to be discharged earlier. And so this is probably the future. Hopefully some of you will start looking at data sets and looking for the associations that we don't even think exist yet. QoS, quality organizational support. The white tower downtown that creates all those red to blue metrics, I had the opportunity to work with them for a while. It is remarkable what they can do. They know what color socks you wore to the operating room that day. Can you link that information to outcomes? Can you figure out how to link that to the registry database? Can you see if you make a difference, what the outcome is in short term so you can shorten that cycle of improvement? I think we can. But you're going to need some support for that. Look for it. This is one of the things I'm most proud of. 3 years ago now, I was lucky enough with Monty Catad from Southern California to be part of the group that created the guidelines for managing infected joints, and we did this in Philadelphia, and I came back having learned about something called the Delphi Consensus Model. 3 months later, we had the JOJ, and 3 months later, we came up with the hip fracture guidelines. Immediately thereafter, I sent out a questionnaire saying, what are you actually doing today? And 3 months later, we asked the same questionnaire, what are you doing now? And we saw that. Unbelievable. I mean, unbelievable. 90% of the people who were at the conference, who originally were doing 60% of the guidelines, at 3 to 4 months, we got up to 90% compliance with those hip fracture guidelines. Have you ever heard of a change management process that was that effective? The answer is no. It's so good, it's going to be published in the Journal of Arthroplasty. Help each other, because those data sets have to be compiled. Somebody has to answer the question. So if there is somebody in the group who actually wants to take the time to do the research, help them be part of the solution. It's really, really amazing what you can do as a group, collecting information into a single repository and then pushing it out. So you can do great research here. Last thing, leadership. This is the kind of thing that we think about as leadership, but in reality, we all lead in the operating room, we all lead in the clinics. We come up with new ways of doing things, publish, talk about it. You all lead different types of people. It's not just the other clinicians, but the nurses, the staff in the room. That kind of leadership needs to be glorified, I think, in some ways. And keep in mind who you're leading. These guys, these are the boomers. They don't mind the guy up front, the red guy in the front who's leading the charge. But these guys, these are the Gen X. They're not so hot on that. And these guys, they're not interested at all. These are millennials. They want to be in the picture. They want this kind of leadership. Leader as someone in the middle. Leader as a support system. The leader who says, I can help you get there. What do you need? Not, this is where we're going, come with me whether you like it or not. So teaching, leadership and research as a triumvirate is an extraordinary, remarkable set of ideals for us to strive for. And I hope that you look back on this meeting, the story you heard from JOJ, what you can achieve in a career. It's amazing. So what are you going to teach? What research are you going to do? Right? Who are you going to lead? Eric has dedicated so many hours to helping us get the next step. And there's so many other people like you in various leadership roles that are doing that. So, I go to work every day at this new building. Can you get it to go, Ron? And as you know, if things don't work out, All right, thank you very much for indulging me. It's been amazing. Amy's in the back. You guys have been for 11 years, or for like 8 years, these guys have been helping put this together, so thank them.
Thanks, everybody. We're going to reconvene.